Botox for erectile dysfunction. Wow! After my last video about Botox for penile enlargement, I did a lot of research, wrote emails and made some phone calls. This is what I found. The news of Botox being able to restore erections in some of those very hard to treat patients has stirred a lot of interest within the urologic community in Germany. So this is really hot news I'm going to share with you in this video. You will learn what Botox is, how it acts upon erectile dysfunction, and what effect to expect. The beauty of it is this: it can be done in an outpatient setting within half an hour without any form of anesthesia. At the end of the video, I will also address safety issues as Botox is a poison, and some of you commented on my other video how afraid they were to get injected with something like that into their penis. In order to understand what Botox can do for you, you will have to understand some basic erectile physiology. Erections depend upon two sausage-like inflatable structures within the penis, the so-called corpora cavernosa. They consist of smooth muscle. When the penis is not erect, the muscle is contracted. Mainly sexual stimulation, but also some other triggers cause nitric oxide to be released into the muscle cells. This leads to relaxation. Blood flow into the penis is increased enormously, and the penis will erect as a result. In ED, erectile dysfunction that is, erection cannot be achieved or maintained. The reasons for this can vary quite a bit, but in the aging male, it becomes more and more difficult for the corpora cavernosa to relax. Among others, corporal muscle tone is increased, and those little helpers which promote relaxation, also known as beta receptors, get reduced with age. The arteries age as well, and nitric oxide also gets less because of endothelial dysfunction. I oversimplify things here. In reality, it's much more complicated. However, all of this may result in a state where current treatment options come to an end, where Viagra isn't effective anymore, where injection therapy doesn't have any effect. For these cases of therapy refractory ED, there might be hope now. The answer is Botox. As I've already explained in my other video, Botox is a poison which eventually paralyzes muscle. It has been used for cosmetic and medical reasons for many years. Despite of it being a poison, its safety profile is very high. So what happens when Botox gets injected into the corpora cavernosa? Smooth muscle will be paralyzed. Paralyzed also means relaxed. Now the corpora fill with blood more easily. Once again, I make it very simple here so that you can follow along with me. In short, it works. A recent randomized placebo-controlled trial in 176 men looked at the efficacy of Botox in vascular ED. Those men didn't respond to Viagra or Trimix anymore and were randomized into 3 groups: placebo with saline injections into the penis, Botox 50 units, and Botox 100 units. The maximum effect was noted after 3 months. Botox 100 units was more effective than 50 units, and 40% of the patients treated with Botox were able to engage in sexual intercourse again. At 6 months, there was still some efficacy left. It is a well-known fact that Botox wears off and has to be repeated. 3 to 6 months is a usual time interval. Let's talk a bit about safety. Although Botox has been approved for many areas of use so far, injection into the penis has no approval. Nevertheless, it is possible to do it, but one has to be aware that this is so-called off-label use. As I have already mentioned, Botox has a very high safety profile, and if anything should happen, the effect wears off after 3 months. This also applies to side effects. In rare cases, systemic side effects may be noted. We're talking about flu-like symptoms and generalized muscle weakness, including difficulties to breathe and swallow. Patients with pre-existing neuromuscular disorders must be monitored very closely. In fact, I personally wouldn't take the risk of treating them. Are there other side effects to be seen? Yes, it appears that this treatment increases penile length. For girth enhancement, there is only anecdotal evidence so far. I'm looking very much forward to further studies because I'm sure this will be a new treatment option for hard to treat patients with ED. Thanks for watching. Bye bye.